Good morning. Well, my name's Angela Mingo. I serve as the Director of Community Relations at Nationwide Children's Hospital based in Columbus, Ohio. And my background is I am an urban planner working for a healthcare organization. So when we're talking about how the built environment can improve health, it's very exciting for me to see these two sectors collide. And so today what I'd like to share with you is a little bit about the work that we're doing at Nationwide Children's Hospital and how we're trying to move the needle on health, especially with our Medicaid population, but more broadly, how we're looking at our neighborhood as the patient and the investments we've been able to make through cross-sector alignment in the area of affordable housing. Thank you. So at Nationwide Children's, we talk a lot about the fact that we are on a journey to best outcomes for our patients and our families. And what you see here before you, this is actually the outline of our 5-year strategic plan, where we've identified a number of core strategies. We've also looked at how are we looking at clinical care and research programs as a pediatric hospital, but also how are we incorporating several key accelerators to execute our work. And so as we look at what is the journey, the best outcomes for our children and our families, we know that health begins before our patients enter the walls of our hospital. It begins where they live. And we've had many doctors, pediatricians who share that they can write scripts for their patients, but if their patients are going back to homes that aren't complementing the prescriptions that they're receiving, then we're not getting those best outcomes for our patients. And so as we look at how do we go into our neighborhoods and really change the trajectory for our patient population, we started to look at wellness and population health and really challenge ourselves to think about how do we impact those socioeconomic factors, or what we've heard this morning, those social determinants of health that impact the wellness of our patient population. So we developed a neighborhood initiative, Healthy Neighborhoods. If I could have that next slide, please. Thank you. We developed a neighborhood initiative called Healthy Neighborhoods, Healthy Families. And this is a 5-prong approach to impacting the social determinants in the neighborhoods just immediately adjacent to our main campus. We're looking at ways to partner with local stakeholders to improve education within our immediate area, workforce development, knowing that education also leads to a pipeline of employees for our hospital. And how are we looking at safe and accessible neighborhoods? I think we heard a little bit this morning about if you don't have a safe neighborhood to go out and exercise and play, you're really hindered in terms of what your health impact can be. And for those of us at Nationwide Children's who are involved in the education component, one of the things that we do is we promote mentoring within the neighborhood by our employees. And it is not unusual for us mentors to go out and talk about health and wellness with our small elementary students and hear them talk about the safety plan they have in their homes, how they plan for gun violence and things of that nature versus not being able to go outside and play because it simply isn't safe. Health and wellness is the area that really is the hub of what we do fundamentally as a healthcare institution. And then affordable housing, which has been very interesting that we've grown into this space, and it has served as the cornerstone for the Healthy Neighborhoods, Healthy Families initiative for over the past 10 years. And if I can have the next slide, please. So as we talk about affordable housing, one of the things that we've done at Nationwide Children's is we've developed in partnership with a community development corporation. I always like to say CDCs, but I have to always recognize my audience. In healthcare, CDC means one thing, and then in the world of community development, it means another. And so we've had the pleasure of partnering with the Community Development Corporation. It is a faith-based corporation that was involved in the area of affordable housing near our main campus. They were doing some work within the corridor, as was the city of Columbus. And so we decided to align forces back in 2008, and we introduced our Healthy Homes program. And sometimes it's just better to be lucky than to be smart. At that time, neighborhood stimulus dollars were abundant, and we were able to take advantage of NSP funds to execute our work. Our focus in affordable housing essentially was one with the undercurrent of healthcare and providing a stable house for families to live in so they could focus on their health. But it was also a focus on eliminating the vacant, blighted properties in our immediate area and increasing home ownership. We were dealing with a home ownership rate of approximately 25%, certainly not the worst in the city, a city of almost 880,000 residents, but definitely not the best. And so we wanted to make those improvements because we know that blight matters, safety matters, and making those improvements would be a game changer for our neighborhood, which we've identified as our patient. When we started this initiative, we had a goal of improving 100 properties in the corridor, a major goal for us being a healthcare institution. Fast forward 10 years, we've been able to improve over 300 properties within this corridor. And it's been a combination of improving vacant, blighted residential properties, but also doing new infill housing and really expanding housing opportunities for residents who live in this corridor and residents who want to reside within this corridor. Nationwide Children's Hospital has invested over $7 million in affordable housing to date. However, we've been able to leverage more than $25 million in affordable housing. And it's been just an incredible journey to see where we started and where we've gone. And as we started this work, originally we were focused on home ownership, really seeing that as a key cornerstone to health, a cornerstone to neighborhood stabilization as well. But what we quickly learned was that affordable housing was in such demand within our corridor, and that in a city of over 880,000 residents, there were more than 54,000 residents paying more than 50% of their income towards rent. And we realized that we needed to shift our trajectory and not only focus on home ownership, but focus on affordable rental housing. And when we started to look at the demographic of the families who were purchasing our homes, we recognized that as an accountable care organization, many of the families that we were touching were families who may have had one or two children, but the majority were empty nesters. They were also employees taking advantage of the housing opportunities, as well as patients who needed to be in close proximity to the hospital. Yet we realized that we could go deeper in touching our Medicaid population by providing affordable rental housing. So we had to be creative. We've talked a lot about the financials of making this work function. And Robin has been a key player in really helping us accelerate our work through the Center for Community Investment and looking at broad ways to go deeper and create pipelines in affordable housing. And so as we started to look out amongst the landscape within our local community, we partnered with a community development financial institution. And we were able to create what is known as a capital stack to stack the dollars available within our community to create a broader pipeline for affordable housing. Now, I shared that we've improved over 300 properties within our investment zone. That was probably about 10 years to get to that point. Thanks to our new pipeline, we are now able to improve up to 170 rental properties in a very short window of time. What you see here, this is actually our capital stack. It's a $15 million loan fund with a 3% interest rate, so well below market. And it consists of over 8 financial institutions who are contributing to affordable housing. And what we've also learned in investing in this corridor is that as we're focused on health, we have friends within our stakeholder group that are also focused on the same community from different angles. And so in working with the financial institutions who are looking for opportunities through Community Reinvestment Act, we're able to find a common denominator. We're servicing the same families in the same communities. And this has allowed us to leverage partnerships that have created great impact for investment within our corridor. Next slide, please. And so one of the things that we've learned, one of the key themes as we talk about improving health is that anchor institutions, healthcare institutions, and managed care organizations cannot do this work alone. We have to identify the partners within our communities who are already in this space, who may need opportunity to really accelerate their work by leveraging bigger partnerships. We're a large nonprofit partnered with a small nonprofit, and it's been incredible to see what we've learned from a small nonprofit CDC that was putting their toe in the water, investing in affordable housing, and are now responsible for over 400 properties improved within a small footprint within our community. And so what we know is that partnerships matter, and they matter at all levels, not only on the local level, but also the state level. We've been a partner in a low-income housing tax credit deal, which was thanks to to a QAP developed by the State of Ohio's Housing Finance Agency, and being able to now incorporate the QAP, or excuse me, the QAP is now incorporating requirements for improving health as we start looking at housing in the state of Ohio. And so these partnerships truly matter. On the federal level, being able to pull down neighborhood stimulus funds, home funds, and other dollars to then layer to do this work has been a huge game changer. And so we're excited to be in the space of affordable housing, knowing that all of the prongs of the Healthy Neighborhoods, Healthy Families Initiative matter. They all help support affordable housing and in the end, impact health. So thank you so much for your time, and I look forward to further discussion.
Thank you.